Namaste dear children, welcome to SRS online classes. This is your social science teacher Gangadhar sir. So previous session we have understood the importance of education and health. In this session we will detailedly analyze and discuss how the government of India is pushing towards education and health, or it is giving importance for education and health. Now we do all know that the qualitative population or the qualitative people or the better human resource only be created by providing them better education and better health facilities. Now, there are various programs, various schemes launched by the government of India to ensure education to the children and to ensure better health facility for the future generation of India. Why do you think that the government concentrate more on education and health, dear children? Because government do know that if you want to create a better society, if you want to create a developed society, you should focus more on education. Because education, it will create a virtuous cycle. Virtuous cycle I have explained you. Okay. What will happen in a virtuous cycle? See, the people who are benefited from education and who are benefited with the good health, they will invest more on education and health of their children, and it will increase their children job perspective, and the standard of living of their children will increase. This is called as virtuous cycle. Now, if you are not going to invest on education and health, it will create vicious cycle. Vicious cycle is negative. I have given example of Shakal and Vilas in the previous session. Okay. Now, there are some programs which has been listed in your textbook. So, for your better understanding, I have codified those things. Just to look at these programs launched by the government of India. See, when India was independence, the literacy rate was hardly 18%. Only 18% of the people we could read and write. That is called as literacy. Now, what is the literacy rate of today? It is nearly 76%. 76% of our people we could read and write. That is called as literacy. Then what is illiteracy? Illiteracy means it is a state where an individual cannot read, cannot write. That is called as illiteracy. I hope that you have understood the meaning of the term literacy and illiteracy. Now, from independence onwards, the government started to spend more and more amount on education. Now, what were the programs? See, first you can observe in Indian Constitution there is Article 21, that is right to life. In that right to life, there is Article 21A, which states that all the children aged between 6 to 14 years, they should be provided free and compulsory education. So, free and compulsory education, it is related to government schools. Okay, it is not related to private unaided schools. Make this one clear, dear children. Don't get confused here. Okay. Now, why this program was launched? Because if you look at the Indian society, there is a huge contrast. What is that contrast? Some section of the society, they are willing to spend more money, much money on the education of children. But some section of the society, they are not willing to invest on the education of their children. See, this will create what we call a sharp contrast. The people who are going to invest more money on the education of the children, they will benefit. The people who are not going to invest more on the education of the children, they will not get benefit. See, one section of the society is going to develop. Another section of the society, it is not going to develop. It will remain underdeveloped. So, it will create a social inequality, economic inequality. All the resources will be benefited by the developed people. This will happen, dear children. That is why government has taken the onus of responsibility to provide better education to its people or to its children. For that purpose, they have launched a scheme, or they have made education as a fundamental right. 6 to 14 years, every child has to be given free and compulsory education. Even a parent, the father or mother of a kid, if they are not willing to send their kid to the school, then according to this law, this act, the parents can be penalized, they can be punished. See, such an importance has been given to education nowadays. Now, second important thing, establishment of Navodaya schools. See, what is this Navodaya schools? Every district they are having Navodaya schools. Now, to get admit in this Navodaya school or to get admission in this Navodaya school, you should pass an examination, which is competitive examination held after your 5th standard. Okay, so it is run by the government. It is not private institution. It is not a private school. It is run by whom? Run by the government. So your 5th standard, from your 6th standard till PUC, education is free. You need not to pay a single rupee. All the expenses, it is bared by the government itself. Now, why the government is doing like that? Because government do know that all the people in our country, they can't afford good education. That is why only meritorious students who are very good at studies, like Shakar in your textbook example, okay, they are provided opportunity to get educated in a better schools like Navodaya. They are residential schools. Every expenditure is made by the government. Now, third one, midday meal schemes. Now, what is the relationship of this midday meal schemes to education? So, we people, Kannada we call it as Bisi Uta. See, it was required. Why? Because I will give an example of my own rural experience or my own village, dear children. When we people got into school, first standard, by the time when I reached 10th standard, only 3 of our friends, we were able to pass out of the 10th standard. So how many of us joined first standard? We nearly 50 students we joined first standard. Only 3 students we were able to pass 10th standard. What happened to the rest of 47 kids here? See, the 47 kids, among the 47 kids, majority of the kids, they were not even having a single square meals per day. They could not even afford food for survival. Now, can you think that the people or the family which cannot afford a food, can they send their kid for schools? It is impossible. So that is why what the government felt was, just by providing free and compulsory education, it is not going to bear the fruits. So additionally, the government said that we will launch a midday meal scheme. Midday meal scheme means what? Providing hot food, serving hot nutritious food for the children in government schools. Now, if you look at the attendance percentage before midday meals and after midday meals, the attendance percentage has gradually increased in government schools. We might criticize it, some people might criticize it, but it is a very best scheme launched by the government, because we don't know what is the actual situation in rural India. When you are provided better nutritious food, then the health of the kid is going to improve. Whenever there is better health, the kid can concentrate more on studies. Say, suppose I am going to tell you, for one continuous day I am going to teach you. Okay, I will not provide you any lunch break or breakfast. Do you think it is feasible for you people to sit and concentrate on the studies? Definitely not. You are going to feel hungry after 1 o'clock. Just imagine the plight or the situation of those rural kids. So they can't concentrate on studies because their health was very low. They could not have a proper nutritious food. Forget about nutritious food. They were not having accessibility to even to a normal food. That is why this midday meal scheme has been launched by the government. It is expending crores of rupees on midday meal schemes. Now, vocational training. Vocational means professional training, like ITI, diploma, polytechnic. All these colleges are established by the government. If the kid is not good at studies, assume that if the kid is not good at studies, okay, then what could be the possibility for them? So that one particular kid which is not good at studies, it can be sent to ITI, Industrial Training Institute. They can learn some vocational classes, vocational training, and they can enter into a industry or a company. So that will increases their job perspective. Okay, so vocational training, carpentry is an occasional training, plumbing is an occasional training, gardening is also occasional training, and preparing food, that is chef, becoming a chef, that is also occasional training, and teacher, occasional training, engineering college, occasional training. They are all professional courses. You will get a job after completion of that particular educational curriculum, that is called as vocational training. Then in first 5-year plan, that is in 1951 and 1952, the government of India spent nearly 150 crore rupees on what? On education. But in 11th 5-year plan, the government is spending nearly 3,766.90 crores on what? On providing education to the kids. And now this amount has been increased. See, you can easily understand here how the government is working hard. It is providing facilities for whom? For the future of this nation. It is investing on the children. It is investing on the education. Okay, assume that you got an MBBS seat after your PUC. Just an example. You got an MBBS seat after your PUC, and government is going to ask a fees. So while you are going for the counseling process, you will know that one. Okay. So what is the government fees here? It is hardly 60,000. The government fees is hardly 60,000. Now, if you are going to get a government seat in private college, they will ask another 1 lakh rupees. That is 1,70,000, 1,50,000 around. Okay. But do you think that only 60,000 rupees is enough for your completion of MBBS? Definitely not, dear children. Do you know what is the salary that is paid to a professor who is teaching in MBBS college? They will get nearly 1.50 lakhs, 2 lakhs, nearly 2 lakhs per month. I am not talking about per annum. Per month they will receive. Then who will pay this salary? That is government. Don't think that you people are paying. You are just paying nominal fees. Nominal fees you are paying. But all the expenditure is made by whom? Made by the government. It requires 80 lakh rupees for government to spend on each MBBS doctor to complete their 5 years course. See, look how much amount the government is spending. Even if you want to pursue a BSc, BA, BCom degree, the government will spend nearly 25 to 30 lakh rupees upon you. We people don't know. We just pay 10,000 rupees, 12,000 rupees. But the rest of the amount, it is paid by who? Paid by the government. Why they are doing this? Because they want to make India an educated nation. They want to make India a better country which is having better human resource. Now, another important scheme launched by Government of India, Sarva Shikshana Abhiyan. What is this Sarva Shikshana Abhiyan? Sarva Shikshana means universal education, simple. Sarva means everyone. Shikshana, education. Abhiyan, it is a movement. So this was launched by Murali Manohar Joshi when he was a education minister at the center. Okay. So this program compelled each and every kid to be an integral part of the schooling system. SSA. It is the responsibility of the teacher. According to this act, it was the responsibility of the teacher to ensure that no children has been left out of the schooling system. Otherwise, we would have been punished. That is SSA. So these are all the measures taken by the government to provide better education. Now, health. Now, I have told you what is the meaning of health. So now, what are the measures taken by Government of India to provide better health facility? Family planning. See, there is a policy called National Healthcare Policy in India. Okay. So this policy always concentrate on providing better health facility. How? You might ask, how, sir? For instance, dear children, I will give one by one example. When you people were born, okay, so you have been vaccinated with different things. So you have been given different vaccinations. By whom? By the government. Without any cost, that is free of cost. I will give a very simple example, general example. So every year, the health department, it is going to launch polio movement. Okay, so where the health workers, they will visit each and every house, every home, and they will put a 2 drops of vaccination, polio vaccination, in the mouth of a kid which is below 5 years. Now, why the government is spending more money on vaccination program? Because government want to ensure that no person, no individual, no child in our country will be affected by that polio. You know that what will happen, what will be the result if you are not going to have a polio drop. So your one of the organ, it might get affected permanently. You might become disabled. So disabled people, the people who are having physical problem, they are not an asset to the country. See, don't take it negatively, but in general terms, in economic terms, we can say that they are not asset to the country. Okay, so that is why polio drops vaccination, universal vaccination program has been launched by the government. In the same way, the BCG, that injection is also provided to the every kid. Why? Because the government wants to ensure that the kid is not going to be affected by any disease in future. They are all precautions. Precautions taken by whom? Taken by the government. Do you think that you people are going to pay for polio drops? No. Do you think that if you are going to visit government hospital, do you need to pay for the doctor? Definitely not. So if you are going to have any problem, any big issues related to your health, if you are going to visit to government hospital, do you think that you are supposed to pay the money? Definitely not. See, especially the rural people, they are much aware about the programs of the government. See, there is a card called Yashaswini card, Arogya Bharat card, Yashaswini card. See, if you are having these cards, then you can also visit any private hospitals which are having tie-up with government, and you can get it treated for a big disease also. So if you are having any big ailment, you could be treated. And who will pay the money? The money will be paid by the government. You need to pay 150 rupees or 300 rupees per year. Only 150 or 130 rupees, I think it is right now. See, this is a government policy. Why they are doing? Because government wants to ensure that the people are getting best health facility. I will give another example, dear children. Recently means 4-5 years ago, the present central government, Prime Minister, they launched a scheme that is called as Pradhana Mantri Jana Aushadhalaya. See, if you go to that Jana Aushadhalaya government medical shop, you will get medicines at lowest cost. The medicines which are or of higher cost in the private medical shop, the same medicines, the same molecular formula, those medicines are available for lowest cost in Pradhana Mantri Jana Aushadhalaya. Now, why these people are, why the government is spending? Because they want to ensure that the poorest of the poor, okay, the last person of the society, the downtrodden people of the society, they should be also benefited from the modern scientific advancement. Okay, see, earlier only the rich people could survive if there was cancer. Now even the common people can survive cancer. Why? Because I have told you, various schemes has been launched by the government. Now just I am going to give some examples, dear children, please understand. Family planning system, family planning program. India is the first country to launch family planning program in the world. What is the meaning of this family planning and why it is related to health? See, dear children, earlier in India, when people were not aware of this family planning, they would got married at the early age, 16 years, 14 years, they would have got married. And when you are going to get married at early age, your body, your physical, what we call as strength, will be not suitable for bearing the kids. Now, when you are going to reach a particular age, that is 21 for boys and 18, minimum 18 years for girls, then you are physically fit. Now, if you are going to marry a girl who is age of 14 years and a boy who is age of 18 years, So their fertility rate will be very high in that particular age group, age period. Now these people, that is child marriage, who have got a marriage, who have got marriage at early age, they will bear more kids. See, into assume that immediately after the marriage year, in 1 year, a girl has bared one kid. Next, in another year, so without any time gap, they would need to bear another kid. See, it created what? It created health problems on whom? On the mother. The mother was not physically prepared to bear that kid. And most importantly, the nutritious availability, the nutritious food was not available to every woman in rural area. You just observe the rural areas, even in urban areas. Nutritious food is not available. Women are supposed to eat at last. After every family member they are going to eat, at last woman has to consume the food. Now do you think that if she is going to eat at last, after doing all the hard work, so do you think that she will be having a better nutrition facility or complete health? So this is the problem with the earlier period. Okay. Now in earlier part of India, that is right after independence, if you just look at IMR, MMR, I have told you what is that IMR, infant mortality rate, the death of the newborn babies who are 1 year below, I have told you in the first session itself that you have to remember. IMR was very high. That means there was less chance of those kids to survive within 1 year. They could not survive at all. Why? Because of these problems. There was no better maternal care. Maternal care was not it was available in a very good way in rural areas after the post independence. Now the government has launched family planning programs. So it is creating awareness among the people. You should marry at this age, and there should be a gap of minimum 2 years to 3 years between one kid to another kid. Okay, so there should be only 2 kids. A family, to have a happy family and healthy family, there should be only 2 kids. Earlier 10 kids, 12 kids. Okay, and there was no guarantee of their survival. Why? If there was a cholera, if there was a plague, contagious diseases, half of the population would be wiped out. Why it would be wiped out? Because of lack of better medical facility. Understand these things, dear children. You just ask these things with your grandfather or grandmother, they will give a better idea. So they will tell always the story. So we were nearly 13 members in our family, 13 siblings. Among the 13 siblings, only 5 of us survived. Why? All the other siblings, they succumbed to death due to cholera, plague, due to fever, due to jaundice. They will give all sorts of examples. Now, it is not possible. The death rate has decreased, IMR has decreased. Why? Of better medical facilities. Who provided better medical facilities? The government. So, family planning, welfare programs and mother-child programs. This is very important, dear children. If you want to create a healthy future, you should concentrate on mother. See, the health of a child depends largely on the mother health. If the mother is strong, if the mother is healthy, if the mother is mentally and physically fit, it will impact on the health of the kid. If mother is suffering from malnourishment, if mother is not physically and mentally capable, then it will pass on to whom? It will pass on to the kid itself. Nowadays we are seeing how the diseases are genetically passed. So that is why today we are giving importance for whom? Mothers. So that is why whenever there is a news in rural areas, if a girl has conceived, if a woman has conceived after marriage, the government will provide them folic acid tablets. Folic acid tablets means iron tablet. It will provide nutritious food to whom? To the home of that conceived girl or conceived woman. It will ensure that there is an institutionalized delivery of the baby. Institutionalized means the baby should be delivered in the hospital, because when there is complications, so you can easily tackle those complications if you are having a better institutional facilities. All these things are done by whom? Done by the government. Then most importantly, vast health infrastructure has been created. What is this health infrastructure? Health infrastructure means establishment of hospitals, provision of medicines, provisions of better qualitative medical staff, establishment of laboratories. This is called as vast infrastructure. Okay, especially in this pandemic situation, there is a discussion of this infrastructure. How hospitals are running out of, they are facing shortage of bed. How there is a shortage of qualified doctors, trained medical facility. How there is a shortage of laboratories. Okay, see, these things are called as vast health infrastructure. Now, health infrastructure has been provided by whom? By the government. If you look at Delhi, in Delhi, there immediately within no time, 5,000 hospitals was built by central government. For what purpose? To provide better health facilities to the people who have been affected by corona. Who takes all this risk? It is the government. Okay. Then PHC, primary health centers. If you are in rural areas, you might have been aware of this. Primary health centers. In primary health centers, there will be one residential doctor. So what is his or her duty? They will treat small ailments or small diseases. Okay. Then CHS, community health center. Community health center, you are going to find it in urban areas. So here the medical facilities are higher. For example, if you go to Chitradurga district hospital, you will find that almost all the diseases are treated in Chitradurga government hospital. Now we are having a kidney dialysis center. Kidney dialysis center, okay. So who are affected by the kidney problem? Dialysis is done. Done by whom? Done by the machine. Now earlier, the people who did not have money, they were not able to spend on kidney dialysis. Suppose a person who is running an auto rickshaw, he could not have that facility. Now he can also have that dialysis facility. Why? The government has established it, and at a low price. The price is very minimal. Okay. So all these facilities are given by the government. For whom? For all of us. So we should make use of it, and then we should create a healthy society. A qualitative population should be created. I hope that you have understood the facilities given by government in terms of education and facilities given by government in terms of health. Now, dear children, these are the two questions today. One is, name the programs launched by the government of India or government on education facility. Then, how government working on the betterment of health or increasing the health of the Indians. So, I have written all the programs launched by the government. I hope that this session was very fruitful and you have understood each and every concept. Thank you, children. Thank you for watching.